We'll get started soon. You're all set, right?
Yeah.
Good afternoon and welcome to today's ECB COVID webinar series. I'm Luc Laven, the Director General of Research here at the ECB, and it's my pleasure to introduce you to Professor Emily Oster. Emily is a professor of economics at Brown University in the United States, and her research focuses on understanding the causes and consequences of people's health choices. Today, Emily will talk to us about the impact of COVID-19 on schools. And this is a very timely topic because the third wave of the pandemic has forced local authorities last week to close schools in the Frankfurt area. But beyond that, the impact of school closures on the learning of children and the productivity of their parents is also, of course, of great importance to our economic analysis here at the ECB. Thus, we look forward to hearing from Emily what we can learn from recent data about school closures. The format of her talk will be as follows. Emily will first give a presentation of about 30 to 45 minutes, and the remaining time will be reserved for questions from you. You can direct your questions to me or to Anna Borlescu via the chat function, which you find at the bottom of your screen, and I will then collect your questions and pose them to Emily. So, Emily, on behalf of the ECB and its executive board, it's a great pleasure to have you with us today, and the floor is yours.
Awesome. All right. Thank you so much. I'm really excited to be here. Let me see if I can share my screen. Can you see that now, Luke? Are we good?
Perfect. Yeah.
All right. Great. So, I am gonna talk a little bit today about what we've been learning about COVID and schools, or what I've been learning over the last really over the last year, but more over the last year, I guess it's been. And then I'm very happy to take questions. I think that we in the US are our schools are starting to reopen at this point. So we've been through a long period with very extensive school closures. So just to kind of set the stage, although I think this is probably fairly familiar to many of us, when the pandemic hit last year, basically all of the schools in the US and throughout almost all of Europe closed for in-person learning. Sweden was an exception. It's not the only exception, but largely everything shut down. And I think that at that time, there were very good reasons for that kind of extreme shutdown. Because if we think about in general how we the way that respiratory viruses tend to work, schools do tend to be fairly significant sources of COVID, of spread of general respiratory viruses. So if you think about something like the flu, or non-respiratory things like the chickenpox or the measles before vaccines, those things are really highly spread in schools. So when there is an unknown pandemic of a respiratory virus, it is very natural for an early response to be like, let's shut down schools, because we think that kids are likely to be vectors or be at risk, and so on. As the pandemic, even as early as maybe March or April, really, as we learned more from China and from some of the places that were hit early, it became pretty clear that at a minimum, children were not a high-risk group. And that's been true for this whole time. And I think there's been debates about their role in spread and so on. But the idea that kids themselves are both at least somewhat less likely to become infected with COVID and are particularly less likely to have serious consequences, that was true fairly early. That was true fairly early on. And as that became clearer, there was some move towards school reopening in Europe. And in the UK, and so you guys know this, but there were some schools. The UK reopened some of their schools, in particular in the kind of late spring and summer. Nothing in the US opened through the end of the school year. So it's not like you literally could not find any open school, but basically no significant amount of reopening occurred at all in the US throughout the entire sort of rest of that 2020 spring. But then in the US, as we got to kind of August and September, even kind of some schools here open in some states in late July, there was some school reopening. It tended to be concentrated in what we would call here the red states, states that are sort of more traditionally on the Republican side of the political ledger. So places like Georgia, Indiana, Florida started to reopen, and in a lot of those places they started to reopen kind of like what we think of as pretty regularly. So they kind of opened for full-time in-person learning, and they did it kind of pretty normal. But many places did not open. And so when we got into the fall, there was some more reopening, and then there were some places that basically stayed closed. And then there was over the sort of fall, there was kind of ebbing and flowing of opening and closing in the US, and some of that in Europe, although I think you guys have been a bit more consistent with opening. In the US, in the winter, the sort of after like the January, sort of after kind of the winter surge, or maybe during it, actually, there was all of a sudden a much larger push for more reopening. The Biden administration has pushed very hard for schools to reopen. And so over the course of the spring, we've seen much more reopening. At this point, virtual learning rates are much lower, although some states still have fairly high rates. And now we're starting to think already about the kind of 2021-2022 school year and what's going to happen there. So in this talk, I want to talk about sort of two things. First, I want to talk a little bit about kind of what we are learning about the consequences of school closures. And there's a lot more that will be learned about that over a very long period of time, but I just want to give a little bit of a flavor of what I think we are getting so far. And then I want to talk a bit more, because this is the part that I've been working on, really, about sort of, can schools be safe, and to what extent are we learning about the safety of schools, and what makes them sort of safer in the US, and almost just how does the data kind of evolve there. So let's start with the consequences of school closures. So the first thing I want to talk about is what happened when we closed schools abruptly last spring. So in the US, when we monitor schooling, most of the way we monitor is in kind of like point in time, large scale, like point in time, high stakes testing, which we actually didn't do much of last spring, because of course it was supposed to happen in the spring and the schools were closed. And so some places tried to do it, but mostly they didn't. So we need to sort of look to other kinds of data to see what was going on. This sort of graph, which I'll explain to you, shows what I think is kind of my favorite source of data on this. So this is a graph that uses data from an online learning platform called Zearn. That's the name of the platform. And Zearn is an online math platform that a lot of schools use. It's linked up to the most common curriculum, the Common Core curriculum, which is what a lot of schools in the US use for their students. And so Zearn is basically like a way that instead of you teaching the math, Zearn teaches the students in the class the math through some like really nicely curated, thoughtful video. It's actually a totally amazing resource if you're trying to homeschool your kids. But what's sort of nice about these data is that they have very detailed tracking. They can see basically how much kids are online at every sort of moment. They can see when an individual kid logs on, and they can see how much they are doing, and they measure learning in something called badges. And so what this graph is showing is that basically we have a set of classrooms that are using this online program before the shutdown. So this is a part of their kind of normal classroom thing. So if you sort of look at this space here, the kind of January, February part of this, we're kind of seeing like, there's a little bit of cyclicality in how many badges kids are earning at any given week. And some of that is just, when's a vacation week and so on. But you're kind of seeing this truck along here. And then this is when schools close. And so what we see when schools close is that there's a huge drop off in these badges that students are earning. And that drop off is very much larger in school districts or in schools that are in districts with lower income families. So if you sort of read this here, this says basically when kids stop going to in-person school, there's something like a 50 to 70% decrease in the basically amount of math that they are doing. So that kind of says, like, more or less, they just kind of stopped doing math. There is also some decrease in these high income districts, but it's much smaller. So this illustrates what I think is the broad picture of what happened in the spring, which is that basically learning was people stopped doing school much, and schools were really poorly equipped. Even very fancy pants private schools, like my kid's school, were just like very poorly equipped to move to some kind of online learning thing. It was just like nobody had any idea what they were doing. Everybody was terrified, locked in their houses with their kids. It was not a good situation to be running an online school. And that was particularly deeply felt by lower income students. And, I will say, I think this is, if anything, kind of an understatement of how bad this was, because this is an online platform. This is a thing where literally they were already using the computer to do the math. So you would think of all the things we could port over into online learning, an online learning platform that we were already using seems like the best thing to port over. Forget about, like, I'm trying to teach some first grader to read by teaching them with some little books. That's going to be a lot harder to port over. And so if anything, I think this probably understates the kind of aggregate losses. In the fall, students come back, and now we have a little bit better, testing, a little bit more sort of sophisticated testing. So one version is something called a MAP test. A lot of these tests. This is math scores, and this shows kind of by grade on the sample that's in this math test, sort of like what's happening in fiscal year 19 and fiscal year 20. So clearly, we are still seeing here reasonably large declines in kind of how students are doing, sort of percentile ranks on these tests. But just to be clear, the scale here is 40 to 60. So, these declines are sizable. I don't want to understate them, but they're not, 70 percentage points. And when we look at reading scores on something like this, actually not affected much. And I would say the kind of general picture of the learning losses in the fall is a dialed down version of the picture in the spring. So it is still the case that the learning losses are bigger in lower income school districts, and that there are some learning losses, but they are attenuated. And I think that's in part because we actually learned a little bit. In part, it's attenuated because some kids are at school, but in part it's attenuated because we learned something about how to do this kind of learning, and that in fact, you could do a slightly better job at it, even if it's not as good as being at the school. The bigger issue, in some ways, which bigger and poorly understood, are all of the other sort of follow-on consequences that I don't think we know very much about yet, that we are going to learn more about as we go forward. So one very big one is just mental health of kids. There are a huge number of kids in the US who are not going to see an inside of the school classroom between March of 2020 and we hope, September of 2021. So that's, kids who basically have been in their houses learning for, 6 hours a day on Zoom. And it's not, just 14-year-olds. We're talking about 7-year-olds. We're talking about 7-year-olds who have spent the entire year, more than a year, only learning on Zoom, not really seeing other people in person. The mental health consequences of that, I think we're starting to see some. We're seeing increases in emergency department admissions for students, for suicide, for depression, anxiety. All of these things are kind of coming out, but we don't have a great infrastructure to measure those. And so I think that's something we're going to be getting more of over time. There are clearly also big impacts on female labor force participation. We saw this very sharply in the fall, where in September there was a huge drop in labor force participation, about a million people, of which about 800, that was almost, it was like 800,000 women. So we're seeing drops in labor force participation, and those drops being sort of very concentrated in women. And actually, one of my undergrads this semester wrote a paper looking at basically how those drops have linked up to schooling, and showing that indeed in places in which schooling was less in person, those declines in female labor force participation were bigger. So not surprisingly, it looks like the sort of, if your kid is not at school, then it is hard for you to be at work, which I think would not surprise any of the parents on this call. Then sort of there's a kind of two other big pieces here, which is just there's a lot of parts of the school learning environment that we are that are not directly measured with things like test scores. So kids dropping out, particularly in, among high school students, kids who are delaying school entry, unclear how big a deal that is, exiting school early, totally abandoning public education. So in the US, one of the patterns is that private schools have largely been open for in-person learning, even as sort of what we call public schools, so like sort of the regular schools that most people are in have not been open. So we've seen places where people have basically just kind of given up on public schooling and gone to a private school or an archdiocese Catholic school. That, those are of course disproportionately people with more resources. If those people start abandoning the public school system, that's really going to change the kind of power dynamics around a lot of these school districts. And of course, there's like a general exacerbation of inequality across students and schools. All right, so now I want to talk a little bit in this sort of second part of this about the kind of school safety, because we sort of, in a sense, like, I think I'm trying to make a case that like the benefit of having in-person school is really big. In the US, we've been sort of fighting against the question of, okay, we all agree that the benefits are large, but if this is spreading COVID to everybody, then we need to sort of try, when maybe we can't have this, and that, like, there's a trade-off, right? And so when we sort of think about school safety, we kind of want to ask the question, like, does COVID spread in schools? And I said at the beginning, I think there are reasons we might think yes. And that is because generally kids spread respiratory illnesses. Early data basically suggested no. So we get kind of some evidence out of the European data suggesting that there was relatively little spread when schools were open. It's sort of generally fairly reassuring. There are sort of related open questions of what kinds of mitigation are important. So should we just open schools like totally regular? Should we be having kids undertaking different kinds of prevention, and what would that look like? And so my sort of way into this is I've been doing a lot of data collection around this in the US, and I kind of got into this actually not as a researcher. So my main job is, being an economist or a parenting author or some other thing, but not being a person who collects data on schools. And I think in the US, we might have thought this would be the responsibility of the government. We do have a federal government here. We have an organization called the Center for Disease Control. We have an organization called the Education Department. Both groups might have been responsible for such data collection. I mean, the unfortunate issue was that until recently, the federal administration over here wasn't really interested in science, and they did not have any efforts to try to do anything that would be helpful. And so what happened is in August, schools started to open. They opened in Georgia, they opened in Indiana, and a lot of us looked out at this and were like, oh, well, okay, well. It's not obvious that's a great idea. Like this was opening right in the middle of like this sort of summer surge in these places. And they were opening these schools and putting all the high school students in, and nobody was wearing a mask. And everyone was like, oh my God, this is going to be awful. But it was like, all right, well, now they did it. Like, I hope that we're going to be able to learn from this. And it became really clear that there was kind of no data effort to try to learn from this. Nobody was collecting any information. And when we came to this, we sort of came with kind of three pieces of question. One is just, are schools like super spreaders, right? Are we going to see enormous outbreaks associated with associated with these high school reopenings or this elementary school reopenings? Is this going to be the thing that like pushes everything? You know, is this the Biogen conference, which was like our big super spread event in Boston? The second question was, okay, well, if there is some super spreading, are there some places that don't do it, and you know, which mitigation factors are gonna matter? And then, you know, third, kind of where is the spread? Who is spreading it? Is it students, staff? Like, what's if we're seeing spread? What's going on? And so we wanted to design some data that would at least get us a little bit at some of these questions. So this is like a lot of the U.S. COVID response. It's a sort of cobbled together effort by just random people. So I got together with something called the School Superintendents Association. So just to be clear, in the US, there are school districts. They are very, very autonomous. So you can sort of think about like there's a school district in Chicago, that's like one school district, but then there are like in Texas, there's 1,200 individual school districts. And often these will be like a district that has, you know, 2 elementary schools, a middle school, and a high school. And so they were basically responsible for making all of their own choices in general, and also in the space of COVID. So decisions about reopening were basically made by these individual districts, which left these districts in a really crummy position, because now there's some superintendent, some person who oversees this district. You know, their normal job is to kind of oversee 2 elementary schools, a middle school, and a high school. Often they also have some other job. If it's small, then maybe they're the principal of one of the schools. Sometimes they're like also the bus driver. You know, these are like pretty like small places. And now you're telling them, okay, you need to be responsible for whether we open schools in the era of COVID. Like if you do it wrong, people will die. Good luck. And I think that was a really high stress situation. And so part of the motivation for this sort of this association involvement here was that these school districts really wanted the answers to some of these questions. We got some principals association. We got a data science team from Qualtrics. We have my team, which was just me. Now it's some other people. And what we did was initially like super simple. We just went out to school districts and we said, hey, can you just tell us like how many people do you have at your school in person, if any? How many staff do you have in person? Are you requiring people to mask? Are you requiring them to distance? Do you do anything about ventilation? And then we came back to them every 2 weeks and we said, how many COVID cases do you have? That's it. That was like our initial basic plan. It was sort of very, very simple. And initially we just did it with a kind of opt-in sample of schools and districts. And then we ultimately added to this a bunch of data from states that had sort of consistent data over time. And we sort of kept adding over time. But unlike in a research project, our goal here was not to like wait till everything was perfect and then, you know, do it. Our goal was to be like, literally, we need to know some of this information right at this very moment. And so we are just going to get this and we're going to post what we have and we're going to say what it is and we're just going to put it out so we can try to, you know, help speak to this conversation. So just to give you a sense of kind of where we are in terms of numbers, we started this effort, basically the sort of first time we posted data was like early September, maybe late September. And we had about, I want to say like 700,000 enrolled students, of whom about half of them were in person during this period. We added a few more, you know, in the first part of September, and then we started pulling in whole states. And so in the kind of, for most of the school year, our data set has been about 12 million enrolled students, of whom, you know, basically about half of them are in person. To give you a sense, the sort of overall US K-12 population is about 56 million students. So, you know, we have some, we don't have all. Here is what, and then we get these like infection rates. And so here is what these look like. And so there are a lot of different ways to put these numbers together and talk about what they mean. But here is the simplest way is to just ask like what share of the students or staff have COVID over a 2-week period. So they sort of given 2-week period. So if there's like, so this is like our sort of top number here is like 1.3. And so what this says is in this, that's like the first 2 weeks of January. In the first 2 weeks in January, of 1,000 staff, we would expect on average to see what is it, 13? Yeah, 13. I don't know, 13. So I'm off by orders of magnitude, or it's a little early in the morning here. We'd expect to see 13 infections. Now, just to be like crystal clear, what we are collecting in these data is information on the number of students or staff who are affiliated with the school who have COVID, not people who got COVID at school. We do not have any information about who got COVID at school. There's like, I'll flag a little bit of stuff at the end about this, but in general, what we were aiming to do was just to find out how many people around your school have COVID. And the reason we went with that approach, partly because it was the only option, but the other piece is if I sort of think about how we were motivated early on and what we really wanted to know, a lot of our questions were just in the space of like, does everybody have COVID? You know, is the school overrun with, are we seeing these sort of big super spreader events? Like what are we seeing? And I think that for that, this is kind of sufficient, right? So if you sort of saw hundreds of people in a given school, that would be a real, that would be a real signal, and that's something we'd show up here. Okay. So this is kind of the pattern of here is really mimicking what happened in the US over this period. We're seeing kind of increase. This is sort of this winter surge, and then we're seeing now things are going much better. It is also true in general that we see staff infection rates much higher than student infection rates. That is very likely reflecting simply age patterns in COVID infections. So kids are less likely to be affected than adults. The fact that we're now seeing these rates kind of come together is reflective of the fact that teachers in the US were prioritized for vaccinations. So as of kind of February, a lot of teachers were already vaccinated, and certainly by the current period, a big share of teachers have already been sort of fully vaccinated. There are some states where we see pretty consistent data, or we see very consistent data over this whole period, in particular New York, Texas, and Massachusetts. So we can sort of graph this. And I actually should say, I mean, we can put it somewhere in the chat. All of the data for this is public, and so there's like a public dashboard. You can poke around in it and see what's going on. And so that was a big part of our goal, was to try to actually make this sort of possible for people to play around with. One interesting thing that comes particularly out of the New York data is an ability to look some at the kind of density of cases, because you might have said, look, okay, maybe overall case rates are low, but maybe we're seeing some concentrations of cases that look like there's a lot of spread in schools. That's actually really not what we saw in these data. So this says, if we look at this is New York at some particular point, 70% of the schools in this biweekly period have no cases, but then of the places that have cases, a large share of them are having kind of one or two, are having sort of small numbers of cases. It really look like those are very likely to have been acquired elsewhere, to have been acquired kind of outside of the school, and then there's just a person affiliated with the school who has COVID. It's not that we don't see any clusters. So there's one, but it's like I can pick out a particular example. So like there's one religious high school in New York that has a cluster of 59 cases. Obviously, something happened in that example, but there's very few of those. It's not like that's something that's showing up every week. That's something we see a couple of over the course of like the entire school year. So finally, sort of a couple other things I wanted to, and I apologize if these are a little small, but in the US, there's been a lot of focus, and I'm happy to talk more about this because I think this has been sort of very different from the European case, but there's been a lot of focus on masking and distancing in schools, and in particular on the role of those things in lowering transmission rates. And so here we kind of divide the sample. I think most interesting is to look at high community transmission, which is this like the time periods and states, locations where there's a lot of transmission. And what we are seeing is that in places where masks are required, we are seeing, particularly for staff, somewhat lower rates. So sort of things that are kind of looking like the masks are protecting the staff from infection. A second very common mitigation in the US was requiring distancing. This is a little tricky to think about because, in fact, if you have ever been to, like, my kid's school says that they do 6 feet of distancing. And, I frequently receive emails full of pictures where the kids are like wrestling with each other. So obviously there's a difference between saying that your kids could be in principle be 6 feet of distance, but in fact, definitely are not. But when we look across those, perhaps for that reason, when we look across these groups for no distancing, 3 feet, 6 feet, we're actually generally not seeing that that's mattering very much for a case rate. So I think the kind of distancing piece of this looks like it's less important than the masking in this period. So final slide is just to well, not final. I have one more thing, 2 more things to say, but final data slide is just to look at one of the things we're trying to figure out, sort of like, how does it look like schools are higher risk than other places? And the answer is basically no, that kind of community rates and school rates are really tracking each other very closely. So there are a lot of limitations to our data, but I think actually rather than telling you about those, of which there are many, let me sort of highlight some other data and say something about what we're sort of learning from kind of almost more academic data, I guess I'd say, that's come out over the last few months. Because one of the things I think our data added was that we were out very early. So in a place when sort of people who were like trying to do careful contact tracing data collection, those papers kind of started to come out in December. I think we were sort of early on in saying, look, our school super spreaders? No, and saying that in early October, when there was maybe more time for some opening. But when better data came out, it does seem to support this sort of general picture. So one is there's like a large data set from North Carolina where they followed about 90,000 students and staff in person school for 9 weeks. There were 773 people affiliated with the school who were kind of like had COVID, who had somehow got COVID. But when they sort of dialed down to like, okay, of those 773, to what extent were there school infections? They saw only 32 of them. And so that's like a secondary attack rate of like 0.04% or something. It's like very, very small number. And importantly there, and this is a very consistent pattern, they did not see any transmission from students to staff. So when we are seeing infections in school, it is largely between staff members. When it was not between staff members, it was either staff members to students or it was students among each other. And again, that last group is actually the smallest, but we do see some, kiddos affecting each other. There's also some data from Wisconsin, which is was also sort of showing very limited transmission. We are in the US, we're very into sports, youth sports. And there has been an increasing amount of evidence suggesting that youth sports are a source of some infection. So there's some CDC stuff about wrestling. And I think what we learned from that is that like an indoor wrestling, unmasked wrestling tournament is a good way to spread COVID. And I think if you sort of think about the mechanisms of COVID and you think about how wrestling works, it wouldn't be very surprising that a sport where you literally put your face next to another person's face might be a good way to spread a respiratory virus. So we're probably not having any wrestling tournaments. So what do I think are the kind of big takeaway lessons here? So I think one is that schools can be operated safely. And then in fact, this is not a high risk environment. One of the most frustrating aspects of this whole discussion in the US is that there have been many places where we have seen, bars and restaurants and gyms and, indoor water parks open and not schools. And I think you guys have had less of an issue with that, but I think for many parents in the US, it sort of felt like, oh, like, are you kidding me? Like, this is not only is this very important, but it's also pretty safe. And so relative to some of these other things, it feels like our risk benefit calculus has been really off. I think there is some evidence that masking may matter, particularly for staff. That may the importance of that may change as more of the staff are vaccinated. Youth sports are kind of a problem. Community rates matter for school rates. As we at least move into the fall, I think that there's a lot of questions about kind of how can we make this school normal. I think there's a lot of fear. And we're going to have to kind of dial that back. But I think we can get there, or I hope we can get there, particularly as adults are vaccinated, community rates have started to go down. So I'm going to stop there, and I'm going to stop sharing, and I'm excited to hear questions.
Great. Thanks so much, Emily. So I have one question on the consequences that you talked about in terms of the widening gap between private and public schools in the US, which of course is a long-standing issue, as you said, for inequality and all that. And you talked about how this gap has increased further from a learning perspective. And then later you spoke about infection rates. The question is whether there are also sizable differences in infection rates between these two different types of schools. So is there something you learn about either the behavior of children or teachers in those two different types of schools, and do you see it in the numbers?
Yeah, so it's a little bit of a tricky question to sort of think about. I think that if you want to think about how to organize this data, the easiest way to organize this data is to imagine that there is very little in-school transmission, and that differences across schools in how much COVID there is are mostly driven by the infection rates in the community and in the sort of groups of people who come to the school. And so is it true that we've seen, I mean, I was trying to think, like, in general, probably rates are a bit lower in private schools, but not in any, very consistent, not in any very consistent way. And I think it really, it is because, the kinds of precautions, everybody's kind of taken pretty similar precautions. And their infections are largely being driven by what's happening in their community, in their communities outside.
Okay, and another question is about the infection rates that you showed in schools, with this interesting difference between teachers and the pupils. So I guess there's sort of two sets of questions. One is sort of this data jumps out to kind of draw a lesson to say, protect the teacher, stupid, kind of, and it happened in the US, but very late in the game, it seems. So is this something that what's your view on that? Should that have happened earlier? But
you mean teacher vaccinations?
Yeah, or some other way of protecting teachers. Okay. Yeah. But indeed, when the other question is in terms of vaccination. So it's very interesting to what you showed, that after vaccination of teachers, the two curves kind of converge. So the teachers and the students curve, infection rates. So could we take away from this is the question that since for children it's low anyway, that if we vaccinate children, it may not make such a big difference. I mean, basically the biggest thing to do was to vaccinate the teachers. Is that one lesson you would take?
Yes. Okay. So let me answer both of those. So I think that on the first thing, I think we understood the importance of protecting the staff, and that was an important group to work with. And I think they were, in many places, the staff were prioritized for vaccinations over, it's like that was a priority group in a lot of places in the US. There clearly is more we could have done in the fall. And so I think many of us felt that we didn't do enough testing, that was kind of a big fall down, was that we should have been doing more like surveillance testing in the fall, focused on the staff. And, that was partly, it was kind of expensive, and partly, there was some resistance and so on. So there clearly were things that we could have done better if we had approached this differently. I think the issue was not so much that we didn't understand that it was a problem, but that it was, that it was we just like fell apart in a lot of different ways. The other kind of interesting piece of this is that you know, a lot of the places that did open, there sort of was a more general kind of, I know COVID denial is just pejorative, but like many of the places that had the most aggressive openings were also places where people weren't necessarily taking COVID, like other COVID things, super seriously. And so it was like, there was a rare place, like the place I live, so I live in Rhode Island, which is a very small state next to Massachusetts. And we are kind of among the very few sort of democratic states which did open most of the public schools. And so there, you know, I think there was a lot of effort to kind of try to do the things that we would need to do to protect teachers and so on. I think there were other places where it was more like, yeah, everybody goes to work, like you go to work, this is your job, go to work, like wear a mask, it's fine. But we could have done more. There are a lot of discussions at the moment in the US around, now that teachers are vaccinated, like, okay, like what's the big deal? Like, let's just like have it kind of regular. And I think that there's a lot of disagreement there. I think part of what's happened is, you know, people are still worried about kids. There's a lot of, you know, a really heated debate here around, you know, kids and vaccines, and okay, those aren't going to be ready for like a while. I think there are people who are like, well, who cares? Kids are a low risk group anyway. Like, let's just like act regular now that we have adults vaccinated. Isn't that what we were waiting for? I think there are other people who say, well, you know, if even one kid in America gets COVID and dies, which of course could happen, that it won't have been worth it. And I think that, you know, we're struggling a little bit here, probably you are also, with how to trade off these, how to appropriately deal with these risks, given the amount of real fear that is sort of that has become, the COVID has been wrapped up in.
Mm-hmm. Yeah, I see. Now, very clear. So there are also two questions around the staff testing intensity numbers that you showed. So one is a more technical question of whether this testing intensity is constant, or whether it could otherwise be adjusted for if it's not constant. And the other related question is whether the data that you presented also covers the period with more aggressive mutations.
The variants.
Yeah. So variants,
right. So we don't, so the testing thing is actually very, so we don't really, no, they sort of, short answer is we don't actually know how much testing there is. We know that this matters in the sense of, like, if you look at the New York data, we know that in the like winter, New York is doing a ton of testing of teachers, and their estimates suggest like teachers were 10 times as likely to be tested as the kind of general population. So of course that's going to kind of drive case rates up some because there's testing more. It would be better if everybody were tested for COVID all the time. I think we all sort of, all this like science people agree with that. That hasn't happened. We're sort of limited to reporting out what we have. I think that, you know, this is why we try to give these comparison rates. We try to sort of talk about comparisons to community rates, where at least if the testing of this group is consistent with the testing in the rest of the community, then those rates are comparable. Of course, if they're not, you know, I mean, again, I kind of often fall back in this on saying, look, there are a lot of really detailed things that we would like, and for which these data are not that well suited. If your question is, are we seeing huge outbreaks in school? I think our data are really well suited for that. I think ultimately there are some other things about the data that will be helpful in kind of long-term things, but these kind of like people will be like, what about lunch? Like, my data is not well suited to tell you like how students should have lunch. You know, we don't have enough information there. On the variants, you know, we are still collecting data now. So we're seeing the data now when there are some places where there are more, you know, there's kind of more variants. You know, people have talked about the idea that the variants are relatively more infectious for kids. My sense of the latest UK data was that that's actually, at least for B117, that's actually not really true. It's just that they're generally more infectious, and so of course they're relatively more infectious for everybody. there's been a lot of rhetoric here around, okay, well, in this latest wave, particularly in Michigan, we're seeing more younger people, relatively more younger people, relatively more kids. It's really unclear whether that has anything to do with the variants or whether it's just that old people are vaccinated. And so the kind of people who are left susceptible are younger people. And because the old people are vaccinated, we kind of opened all kinds of stuff. And then people started going out and doing stuff, not particularly going to school, but, going out and going to bars and restaurants and doing this, that, and the other thing. And then some people got COVID. So I think it's hard. The data is making it hard to separate out the role of variants from everything else, at least in the US.
Thank you. Next question is, do we have evidence that the consequences of closing schools can be overcome in the future? Most people seem to think that they will.
So I think there are some things for sure which we cannot overcome, some things which I think we are likely to be able to overcome, and some things where we don't know. So I think on the first piece, sort of things we can't overcome, there are choices that were made in this year that will not be easily undone. So there are students, high school students who dropped out, who aren't going to finish high school, and they're not going to come back and finish it next year. Like, we're not getting those people. We're not getting those people back. Those are real long-term consequences that we will see. I'd also put in that group, the category of kind of people who left their jobs, like parents who left their jobs, who may of course return, but we know that when you take a gap in your resume, you're less likely to return. You return in a different way. Like, we're going to see some real losses there. I think those will not be made up. Then there's the more basic question of like, look, some kids didn't really learn the second grade. Like, are they going to be able to catch up and like learn the third grade? And there I'm kind of more optimistic, because I think that if we have that, at least with appropriately used resources, we could catch up a lot of that. We know that one-on-one tutoring can be helpful for kids. If you think about a lot of these early stage things, like kids need to learn to read, they need to learn to like add and subtract. We kind of know how to catch people up on those when they're behind. And if we get enough resources in place, I think we'll be able to do that. The place where I think we're least sure is this piece of kind of like mental health, sort of long-term, like socio-emotional, like trauma, basically trauma scarring of, this was not, even for people with a lot of resources and kids whose families have a lot of resources and have a lot of computers and have a parent home and whatever, this has been really, really challenging. I think it's just not the way that people want to be. And I think people are seeing a lot of those kinds of consequences. We're going to have to see how they play out over time.
Yeah, actually, the previous speaker in our series spoke about mental health, and it was a pretty alarming situation indeed. It's bad for the children and the parents and basically everyone. So
yeah, I think it's bad for people's relationship with their kids. I mean, this is not the relationship that many people wanted to have with their, with their kids.
No, and it is very striking how also what you said about, it's not necessarily the math skills, but it's the social interaction skills. That was. Could you say a little bit more about that?
Yeah, I mean, I think it's sort of interesting, because I see this partly because the people I know, the people I talk to the most, I see this from kind of the standpoint of, the people who in some ways are the most privileged, which is like people who, who have a lot of resources, who maybe have the time to take some time, whatever, with their kids. And I think one of the things that happened for many of those people, and I sort of candidly for me, is that we had this sort of idea that like, if your kids are like, we're like homeschooling our kids, like they'll learn so much math, and like we can like really like use this opportunity to like, I don't know, like not this an opportunity, but like people sort of thought like, okay, my school doesn't push them enough in math, and I'm going to push them more. And I think one of the things people learned is like, actually that like sometimes you can do that, right? Like actually there are some good online platforms for learning math, and it is possible for your kid to keep up in those things, or maybe even just sort of move beyond. But that what was really, really missing is the part where you like interact with other kids and where you go to school. And that piece of school is so much more important than I think many of us recognize. And when we think about school as kind of, okay, you go to school to learn to read. Yeah, that's something people learn at school. But you could teach your kid. Maybe you know how to read. You could probably teach your kid to read. But the thing you cannot deliver is the environment of like learning to interact with other kids and learning to how to problem solve. And I think as people's kids have gone back to school, they have realized that they're kind of like, they missed that, right? They sort of missed a period of that. And that is a huge part of what we are doing with education, is teaching people to interact in a society and to work out problems that they have with other people, because ultimately as adults, like, that's actually a really important part of being a person. And when people have asked, so one of the questions people sometimes ask is, what do you think will be, what do you think are some long-term changes that we'll see, around sort of society, around after this, or around schools rather? I think we will see, I think the two big things we're likely to see are, one, a move to more individualized online instruction for some things. So actually one really good learning here for the US is that there actually are some really good ways that you can help differentiate kids and help kids sort of who are behind catch up, and who are ahead, move beyond, using these kind of online learning platforms. I think we will see much more of that. But I think in exchange, we will see a lot more focused time spent in school on some of these socio-emotional curricula, where they actually try to teach you how to problem solve in social situations, where they try to sort of teach you the kind of like how to be a person, in the same way you would try to teach like how to act. And I think we'll see a little bit of that shift.
So, so then there's one question which is very US specific, I guess, which is the stark difference that you showed in terms between, again, the public schools and the private schools, but it also mixed with the socioeconomic kind of background. So what, from a European perspective, seems a little bit strange is that there wasn't sort of a much stronger pushback to keep schools open, because at least the way we look at the US is that the social safety net is weaker. Daycare facilities are not available for everyone. You have very few vacation days. So if you are a working parent and the school is no longer there, how do you manage? This was difficult here, as many colleagues can echo, but to us, it's like, I mean, I guess it's sort of like, what's behind the numbers, the data that you show? It must have been awful.
Yeah, I mean, I think there are sort of two things that are probably very different. I don't know exactly how important they are, but I think that sort of they're kind of two I would highlight. So first of all, I will say a lot of people are extremely angry about this. So it's not like everyone was like, oh, this is a great system, like everything's going great. Like, people were very mad. But I think the two things that have made it difficult to make progress on this are, one, I think actually a lot of families were scared. So, and I think that our approach to our kids, I was talking to a sort of European colleague about this, and he said this, and I think it's kind of right, although I don't have empirical evidence. I think that in the US, we have a much more like safety oriented, like, we're like much more cautious about children. It's like there's a rule, like, kids under, there are rules like, you can't let a kid play outside by themselves like if they're under 12, right? So we have a sort of set of things which I think are a bit different than some of the norms in Europe around kind of child independence, and I think reflect not things about how much you like your kid, but just like aspects of physical safety that the US sort of takes a different approach to than some other places. So I think some of what happened is just there wasn't as much push to reopen as you might have thought, because people were afraid that their kids would die, even though that was like not realistic, or not very really tremendously unlikely. There was just like a lot of fear. And that's one piece. But I think a much bigger piece is that in a lot of places, the teachers' unions opposed reopening, and the kind of That's just like, that's like a factor in the US. And if you look at kind of where schools open and where they didn't open, a lot of that has to do with, you know, where the teachers unions were powerful. That interacts with the first piece rather, because I think some of what happened is teachers, even when schools were going to start to open, teachers actually in some cases would say to their students, you know, or to parents, like, don't send your kid back because the district is trying to kill us. The district is trying to kill the teachers. And I think that's continued to be, and it's not all like, it's not all by any means all teachers. And I think this has been a big issue within these unions, that people do want to go back and some people don't. But that's the union piece of this is clearly a factor.
That's very interesting. Yeah, that's of course, that's very different here indeed. So a related question is, how do low-income families deal with the issue of lack of hardware to do homeschooling in the US, and this was an issue here in Europe?
Almost all the districts. So this is like the one thing that people did in the fall, is basically a huge amount of money was spent by districts to give every kid a laptop. So we basically went to like sort of most of these poor urban districts went to kind of one-to-one. Every student gets a laptop or an iPad, and they just delivered them to them. And then actually in a lot of places, cities and municipalities set up Wi-Fi. Like, so now everybody had Wi-Fi. So that was like one thing we did that was okay.
Good. So a different question here is actually something you haven't talked about, and I don't know if you have done research on yourself, or maybe you have seen research by others, but basically universities. I mean, you're yourself, of course, at the university, and we think of university students as adults.
Do we think of them as adults? Okay, sure, some people might. Okay.
So how much of what you have to say sort of basically applies, you think, also to the university?
Almost none. So I think one of the things that has been so striking about these discussions is that, like, while we are simultaneously saying, like, you know, we're not seeing a lot of outbreaks in schools, we are seeing, like, in the fall, there was like huge outbreaks in universities, and it's continued to be true, right? So I will say, like, it is in some ways really astonishing that we didn't see bigger outbreaks in high schools, because if you like look at a map of Pennsylvania, you can see where Penn State is. Penn State is Penn State College. Like, you can see that on the map of the COVID map, because it's like a bright red chunk, right? They just like had like hundreds and hundreds and hundreds and hundreds of cases. And of course, most of the students are fine, like this is a low risk group, but we saw just huge outbreaks in universities, and the places that managed to kind of keep those under control. So like my university, we did pretty well, but we still had some, you know, reasonably sized outbreaks, particularly in the winter. And that was in the context where we tested every single person who was on campus twice a week since August. And so every day, twice a week, I go and get tested with like a PCR test, and we process it, and we're doing that for everybody, and still we had some outbreaks. And so, you know, in some sense, like the university environment, in terms of, I don't think we have a great understanding of why, but some aspect of this has meant like these are just very high risk people, environment, something, and they're not like schools. So
So zero correlation. Okay,
basically good. Zero correlation. Yeah. I mean, I think here in the US, when people come back to university in the fall, I think every place is going to require vaccines for students.
Well, Emily, so I've run down all the questions, and anyway, we are at the end of the talk.
Good timing.
So very good timing indeed. And so thank you so much for doing this. I hope we can share your slides, and anyway, the videos available. So wish you all the best.
Thank you. Good luck with your schools.
Yes, same to you. Okay, bye now.
Bye, everybody.